Governor Murphy, as soon as you're ready.
Thank you. Good afternoon, everyone. I hope you had a great Memorial Day and start to the summer. I kicked today off in Bergenfield at high school in Bergen County with U.S. Secretary of Education, Dr. Miguel Cardona. It was great to see kids and educators in classrooms together. Thank you all for joining us for what is our 200th briefing since the start of this pandemic. I don't think this is a milestone any of us could have ever conceived of reaching at our first briefing back on March 13th, 2020. But as we reach it today, we do so in much better shape than at any other time over the past 15 months. I'm joined today by the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persicelli, the state's epidemiologist, another familiar face, Dr. Christina Tan, another guy who needs no introduction, the Superintendent of our State Police, Colonel Pat Callahan, and to Judy and Pat especially, although Tina's been there every step of the way. You all have flanked me for nearly every one of our 200 briefings, and I thank you all for what you personally and your teams have done. Over these 200 briefings, we have reported the numbers to you as they are given to us each day. We've ridden these curves as a roller coaster these past almost 15 months, and we've always been upfront with you about the challenges we faced, and we have strived to give you the information that you needed to keep yourselves and your families safe. It certainly hasn't always been good news, but together we are getting to a good place. As you can see, I don't need to tell you, we are virtual today, and there's a good reason for that. We have the great honor of being joined today by the White House COVID-19 Response Coordinator and very good friend, Jeff Zients. Jeff, it's great to have you with us. I'll ask Jeff to speak to our position in this race as a nation against COVID in just a few minutes. But first, I want to just give us a little bit of grounding as to where we currently are. And let there be no mistake, we are where we are today because of the great partnership that we have had with Jeff and his team since President Biden and Vice President Harris took office in January. As I mentioned, I hope you had a great Memorial Day. We just came off Memorial Day weekend, and though the weather may not have been as cooperative as we could have hoped, there is no doubt that for many of our businesses, especially, it was a successful weekend. And even with bad weather, our Shots at the Shore program succeeded in giving 235 individuals their first vaccine doses on Saturday and Sunday in Monmouth County. I know Judy will have a fuller report. All totaled, we are today counting a total of 4,259,893 fully vaccinated individuals. Our in-state sites have fully vaccinated, as you can see, nearly 4.1 million of those who live, work, or study in New Jersey. The Department of Health has counted just shy of 168,000 others who have been vaccinated, New Jerseyans, but vaccinated out of state. And looking at the CDC numbers, more than 5.3 million New Jerseyans aged 12 and older have now received at least their first dose, and that's more than 70% of the total vaccine eligible population. We are one of only 6 states, and the largest, I might add, to crack 70% of the 12 and up population having at least their first doses. With 60.5% of our total population having received at least their first dose, we are 7th in the nation in this regard. Again, I don't say with any sort of patting ourselves on the back, but I would put our vaccination program up against any state in the country. Remember, no state is as dense as we are, or no state is in a region as dense as we are. No state has such great diversity in such limited space. Not that we're in a competition with any other state. Please know that we all must reach the finish line, and we do nothing but root for our fellow states. But we certainly are meeting all of our objectives, and having a White House that is working step by step with us is a huge reason why. Judy, I looked up at the communities today. The Civil Corps is knocking on doors in 12 communities. It's the 10 that we announced last week, and the new ones, at least I've got as of today, are Clifton in Passaic County and Hamilton in Mercer County. And because of this effort, we have COVID on the run. We are reporting only 290 additional positive cases today. The positivity rate is 2.12%, and that's as of a Saturday. And remember how much higher the weekend positivities had been until a couple of weeks ago. Rate of transmission is now 0.73. That's good news. Hospital count, a total of 518. That's the lowest it's been since October. ICU and ventilator counts are each both at levels we haven't seen in 8 months. Discharges and new COVID positive admissions both continue to trend in the right directions. Thank God we've had a number of single digit losses of life of days in a row. Anything north of zero is a tragedy, but thank God these numbers have begun to come down. Remember, those are not yet confirmed. I cannot overstate how important the partnership of President Biden and the Biden administration, especially through Jeff and his team, has been to our ability to crush the curves again and to achieve these numbers. From getting us the vaccines to partnering with us directly and setting up community vaccination centers, this has been a collaborative effort at every step, and there is a direct correlation between the increase in vaccinations and the decrease in cases in hospital counts. Moreover, Jeff and his team have remained eminently accessible, in constant touch with us throughout, whether it's with me personally, Chief of Staff George Helmy, Judy, or Pat. Every one of our calls has been answered. And with that said, it is now my distinct pleasure and honor to turn things over to the White House COVID-19 Response Coordinator, Jeff Zients. Jeff, take it away.
Well, thank you. It's an honor to be here. I just thought I'd start knowing New Jersey with my credentials. My mom was born in Elizabeth, grew up there, my father in Newark. So I feel like I've got a little bit of credibility coming in here. And thank you, Governor Murphy and team, for inviting me to this 200th briefing. That's truly remarkable. And we all admire your extraordinary leadership, the governors and the teams, and the commitment to leading with science, facts, and transparency. That's exactly what President Biden said he would do when he entered office, and it's what you've been doing from day one. And honoring the memory of people we have lost to this virus. You remind everyone that behind each data point is a human story. And as you said, anything north of zero is a tragedy. And we it all reinforces why we're pushing so hard to get more folks in New Jersey, even more folks in New Jersey and across the country vaccinated. I want to thank you right back at you for your incredible partnership with the Biden administration and for all that you're doing to win the fight against COVID-19. You know, to use a benchmark, let's remember where we were when President Biden took office, which is about 4.5 months ago. In the governor's terms, it was 39 briefings ago. We were averaging 184,000 cases per day nationwide. Tragically, more than 3,000 Americans were losing their life each day. And our daily lives had, in many ways come to a halt. It was not life as we know it at all. And it was very difficult for everybody. Today, just 4.5 months later, we're down to fewer than 20,000 cases per day, and deaths have dropped by over 85% across the country. As you just reviewed, Governor, you've made extraordinary progress in New Jersey, including a 93% decline in cases across the last 4.5 months. To be clear, we're further ahead in the fight against the virus than I think anyone thought we would be at this point. And as the president says, the light at the end of the tunnel is getting brighter and brighter each day. And I think we've gotten to this point, I would argue, because of 3 key reasons. First, the president, and he started this during transition, mobilized a plan to have a whole of government wartime effort to build for the first time a nationwide vaccination program and support the state efforts that were ongoing. In New Jersey, since the president took office, that's meant working with the governor and team, providing over $208 million in federal funding for your community vaccination sites. To complement the strong team that you have in place, over 700 federal personnel were deployed to your state to support vaccination, and over 500 federally funded National Guard members working on the COVID-19 response in your communities. We've also gotten vaccine doses directly to the community health centers in your state and over 1,200 pharmacies across New Jersey. And in partnership with the governor and team, the federal government stood up a mass vaccination site in Newark, run by FEMA and the U.S. Air Force. Second, governors like Governor Murphy have worked to get the job done at the state and local level. The governor and his team have built one of the best performing vaccination programs in the nation. I hear that from my team all the time. One of the best performing vaccination programs in the nation. You were one of the first states, as the governor said, to hit the important milestone of 70% of adults with at least one shot. Now you're continuing to drive that percentage even higher, with more than 74% of adults in the Garden State with at least one shot. That I believe is sixth best now in the nation. And 61% of adults in New Jersey are fully vaccinated, which is obviously important that people go back and get their second shot. You know, from working with houses of worship to build vaccine confidence in post-vaccination clinics to meeting people where they are in the community through mobile units, including at the beach this Memorial Day weekend, to incentivizing vaccinations with free passes to state parks, and even the chance to have dinner with the governor, which I think is an incentive, and certainly with his wife, which is certainly an incentive. So really cool stuff going on in the state, consistent with all the best practices that you've implemented. So I think just overall, Governor, you and your team are doing outstanding work. Third, and most importantly, our progress is possible because nearly 170 million Americans, including more than 5 million in New Jersey, have done their part and gotten vaccinated. In a state that you know well was hit hard and early, New Jerseyans have heeded the governor's call. You've gone out, gotten your shot, gotten your friends and family to get the shot, and done what it takes to put New Jersey on the right path. As a result, in communities across the state and across the nation, the virus is in retreat. This isn't just saving lives, it's letting folks in New Jersey and across the country get back to living their lives. As the governor says, public health drives economic health, and the progress you've made in advancing public health and improving economic health is thanks to the hard work of millions of people in New Jersey. But for all this progress that we've made, we're not done yet. Many communities have lower levels of vaccination, putting them at higher risk now and going forward. And no matter where you live, if you are unvaccinated, you are still at risk. That's why today, in fact, in a few minutes, the president is announcing a national month of action to mobilize an all of America's sprint to get more people vaccinated by July 4th, including new commitments from some of the largest child care providers in the country to provide free drop-in child care to parents getting vaccinated. Extended hours at pharmacies for vaccinations, including many pharmacies open 24 hours every Friday in the month of June, starting next week. And continued commitment from the private sector to incentivize vaccinations and celebrate our progress, including free beer for everyone over the age of 21 on July 4th, courtesy of Anheuser-Busch. They just announced that this morning. You can visit vaccines.gov/incentives to learn more about free childcare and other incentives to get vaccinated. That's vaccines.gov/incentives. Together, we've already made so much progress across the country and in New Jersey, and we're counting on New Jersey to keep up the amazing good work. To give it your all through July 4th by taking advantage of the governor's Operation Jersey summer incentives and getting vaccinated so we can enter the summer safer, free from fear, enjoy a beautiful summer on the Jersey shore, and celebrate our independence as a country from the virus on July 4th. We know you'll make us proud. You have at every step of the way. Congratulations on all the progress. Thanks for the good work still ahead. And now back to your great governor. Thank you, Governor, for the opportunity to join you.
Hey, Jeff, thank you so much. I know you got to run to be with the president, but that was really, first of all, thank you for your gracious words. And most importantly, for your extraordinary leadership. Please give the boss our best. And you are full on Jersey cred. And anybody who's offering up free beer on the 4th of July, Callahan and Murphy and several billion other of us got really happy just now. Thank you,
Well,
man.
thank you. Thank you for the great partnership. You've been stellar, and we count on it going forward too. So thank you, and I'll give the president your best. Thank you.
All right, Jeff. Thank you for everything, man.
Thanks.
Take care. Again, I want to thank Jeff and his team. They've been extraordinary for the support and for being with us today. And as he said, we still have a lot of work to do together to defeat this virus and then to spur the economic recovery, both here in New Jersey and across the nation. But I promise we will continue to stand with Jeff, with President Biden in all of these efforts. What a treat to have him with us today, and what great work he's done and continues to do. Moving on, I got a couple of quick announcements, if it's okay. First, with close to 1,800 vaccination sites located across the state, the time has now come for us to begin to transition away from the mega site model that we built at the very beginning of our vaccination effort, and to the community-based model that will see us through to the end. Because of this, we're now scheduling the final shots for our mega sites. So here goes. As of today, both Atlantic County and Gloucester County mega sites have stopped delivering first doses. The Bergen County mega site at the Meadowlands will administer its final first doses on Friday. These sites will remain open to ensure that everyone who scheduled their second doses at these sites receives it. The last day, as you can see in the chart, of those second shots are June 18 in Gloucester County, June 19 in Atlantic County, and June 24 in Bergen County. And then let's look at the other three mega sites, if we can. Final first doses in the Morris County mega site at Rockaway Town Square Mall will be on June 23, and the final day for their second doses on July 16. The Middlesex County mega site at the New Jersey Expo Center will give its final round of first shots on June 26, and the last follow-up doses on July 17. And the Burlington County mega site at Morristown Mall, will discontinue administering first doses on July 1 and will remain open for second shots up until July 23rd. Also of note, as you can see at the bottom, the federally run Community Vaccination Center at the New Jersey Institute of Technology will remain open until June 20th. I'm in a room where if you don't move around, the lights go out, so excuse me 1 second. I'm back. That's technology for you. For the past 5 months, these sites have been the backbone of our overall vaccination effort as we built out and into every community across the state. Combined, these sites have delivered nearly 2 million doses and have fully vaccinated, as you can see, more than 954,000 individuals. We are exceptionally grateful to the healthcare systems who partnered with us at each of these sites, and to their nursing and administrative staffs, Atlantic Care, Atlantic Health, Hackensack Meridian Health, Gloucester County, RWJ Barnabas Health, and Virtua Health. And we thank all of the partners, whether they be federal, state, or local, who provided essential on-the-ground services that made these sites run, including FEMA, the New Jersey Office of Emergency Management, and the All Hazards Incident Management Team, county and local law enforcement, state police, National Guard, health officials at many levels, among so many others. This is in no way means that our job is done or that we've accomplished our overall vaccination goals. We still have work to do. But as I've said, we are now at the point where our attention will be focused on the local and community-based sites we've spent the better part of the past 6 months building and supporting. Whether it's at your corner pharmacy, at a school, at a house of worship, participating in our Grateful for the Shot program, whatever it is, this phase is moving forward at full speed. Remember, we've been saying this now for the past month. We're going on the offense. We have to bring the vaccine to people, and we are going local. We're localizing, and this is yet another step in that direction. Wherever you live, there is a vaccination site near you, and I encourage you, if you have yet to be vaccinated, to visit that website, covid19.nj.gov/finder, to find that location nearest to you. Every New Jerseyan who wants to be vaccinated will be vaccinated. That's our promise, and that is our goal. And by the way, Relatedly, we do not want any worker to feel that they have to make a choice between going to work or getting vaccinated. For this, the Department of Labor and Workforce Development under Commissioner Rob Angelo is reminding employers that they are to honor earned sick leave for any worker to travel to or from a vaccination location or to take a day off if their side effects may require. We are certain that some workers who have not yet gotten vaccinated because they do not want to lose even an hour's pay, and that's a fact. Research has reported nationwide that the majority of these concerned workers are from our Black and brown communities. This should not even be a consideration. Protecting public health is critical for protecting our economic health. I thank Rob and his team at the Department of Labor for their work, and I thank every employer in advance for their cooperation. Now let's get back to today's numbers because we have one more set to report for today, and it's with the heaviest of hearts that it is our obligation to report another 20 New Jerseyans have passed due to confirmed COVID-related complications, and the number of probable deaths was also updated now to 2,678. As we do every day, let's take a minute to remember 3 more of those blessed members of our community who we have lost. We begin today by honoring this guy, Robert Campbell III of the Bayville section of Berkeley Township in Ocean County. That's a place in Jersey I know well. Rob was just 47 years old, folks, 47 years old. He grew up in Lacey Township, and as I mentioned, in Bayville, and he called Bayville home for most of his life. After his graduation from Central Regional High School, Rob found a career in the bread industry, most recently working as the general manager for the New Harvest House Bakery in Farmingdale, a part of the Gianella's Bakery. Away from work, Rob loved to go fishing and boating, 2 pastimes made easy through a life spent along the shore. But most important to him was time spent at his home in Bayville, alongside family and friends. Rob leaves behind his wife, Lydia, his grandson, Xavier. His daughter, Caitlin, passed away tragically 5 years ago at the age of 22. Please keep her memory in your prayers. And he leaves behind his 2 stepdaughters. He's also survived by his mother, Karen. Keep her in your prayers. She had COVID-19. And his brother, Christopher, and 4 nephews. He also leaves 2 half-siblings, Jerry and Diane. Lydia and I had the honor of speaking last Wednesday, and she reminded me that Rob was in the hospital for 53 days through twists and turns before finally succumbing. God bless Rob and his family, who he leaves behind. Next up, we remember this guy, Millville's Augustus Gus Ledoux. Gus was born in upstate New York, in Binghamton to be precise. He was educated as a chemical engineer and glass technologist and moved to Millville when the area was still the center of the nation's glass-making industries. He would later teach and pass on his knowledge as an adjunct professor, both at Cumberland County College and Gloucester County College. Gus was 85 years old at his passing. Gus is survived by his wife of 61 years, Joan, and 5 of their 6 children together, Catherine, William, Michael, James, and Jonathan. A daughter, Susan, had previously sadly passed away, and he leaves behind numerous of their children and their grandchildren or his great-grandchildren. I spoke with Jonathan last Wednesday. I had the great honor to have a conversation with him. He said 2 things. My dad worked until his death, literally, and then his mom, Joan, still mows her own lawn. Wow. We are honored that Gus chose to make his home in New Jersey, and we thank him for all that he added to South Jersey's rich cultural and manufacturing heritage in glassmaking. May God bless and watch over him and the family he leaves behind. Finally today, let's honor that woman, a true Jersey girl, Monmouth County's Kathleen Avino. Kathleen was born in Neptune and a longtime resident of nearby Manasquan, a life spent along the shore. With a degree in arts from Keene College, Kathleen found a job as a librarian and educator with the Matawan Aberdeen School District. That was the start of a more than 38-year career. Along the way, she would also meet her husband, who was a math teacher. Kathleen served as the superintendent's representative to the Matawan-Aberdeen Public Library Board of Trustees, along with advising the high school's literary and art magazine, coaching the chess team, co-advising of the district's chapter of the National Honor Society, serving on the faculty advisory board, and helping to lead Girl Scout Troop 645. Retirement meant that Kathleen could focus on her other pastimes, including jewelry making and collecting Pez dispensers. Kathleen leaves behind her husband, Peter, with whom I had the great honor of speaking last Wednesday. He now works, by the way, for the Jersey Shore Blue Claws, the single A Phillies affiliate. And she also leaves behind her daughter, Kate, in Florida, along with an extended family and many friends and former colleagues. When the Board of Education recognized her long career upon her retirement, Kathleen responded simply, and I quote her, "It's been a pleasure." I have a feeling that that went both ways. On April 29th, 2 trees were planted outside Matawan-Aberdeen Regional High School in her honor. We thank Kathleen for her years of service to the Matawan-Aberdeen schools, and may God bless and watch over her, and may those trees grow tall and proud. 3 more extraordinary lives. On Monday, by the way, we'll be back together. We'll remember 3 more. Each one represents the many more left unnamed here, but remembered by families and friends across our state. Moving forward, I want to recognize another of the great small business owners making a difference in their community. Meet Lisi Cielo, who is a proud member of our Dominican community and is the owner of Cielo's Floral Designs in Passaic, which has been in business on Main Avenue for the past 14 years. The pandemic decreased business in her store, but a grant made possible through the Department of Community Affairs Neighborhood Preservation COVID-19 Relief Grant Program meant that rent and utilities would be paid. Not satisfied to just protect her business, she assisted the barbershop next door in applying for their own grant, which they received, by the way. That meant 2 businesses were saved, and Lisi's generosity of spirit and community focus are the reason why. I had the pleasure of catching up last Wednesday with Lisi to thank her for keeping the spirit alive on Main Avenue through some really tough times. Cielo's Floral Design is a true community anchor. Check them out, by the way, at cielosfloraldesigns.com. cielofloraldesigns.com. Now, before I turn things over to Judy, a reminder that on Friday, all indoor gathering limits will be lifted, including the limit on seating at indoor venues with at least 1,000 fixed seats. We are ready to take this next step, and we ask that you be respectful of your neighbors at these facilities who may feel more comfortable wearing a face mask. Also, this is kind of cool. This week marks the 100th anniversary of the birth of a Jersey musical icon, a composer, band leader, and thought to be by many the best musical arranger of all time, Nelson Riddle, born June 1st, 100 years ago yesterday, in Oradell, in Bergen County, in New Jersey. He worked alongside Nat King Cole, Ella Fitzgerald, and quite famously, 200 different cuts with Hoboken's Frank Sinatra. And that is to name just a few. And finally, as of yesterday, not only are Charlie Murphy's 20th birthday and the 100th anniversary of Nelson Riddle's birth, but we kick off June, which means it is Pride Month. Throughout June, we not only honor and celebrate the accomplishments of our extraordinary LGBTQIA+ communities, but we recommit to ensuring that New Jersey remains a state that honors all who call it home. We know that the pandemic has been especially hard on some in our LGBTQIA+ community who have suffered from longstanding inequities in access to healthcare. And we also recognize the especially hard road for transgender New Jerseyans and commit to doing all that we can to ensure they live a life of dignity and pride. So happy Pride to one and all. And I'm pleased that this year means the celebrations and parades can return. With that, please help me welcome the woman who needs no introduction, the Commissioner of the Department of Health, Judy Persichilli.
Thank you, Governor, and good afternoon. We continue our work to bring vaccinations into communities, making it more convenient for residents to get vaccinated. And despite the rainy and windy weather over the weekend, vaccines were administered throughout the weekend with 235 shots given in Asbury, Long Branch, Sandy Hook, and grateful for the shot events, which brought vaccinations to congregations and targeted communities. On Saturday, 293 doses of vaccine were administered at Our Lady of Guadalupe in Lakewood, and at St. Stephen's Grace Community Church in Newark, 195 doses were administered. Pop-up vaccination clinics like these are playing an important role in helping to get people vaccinated in our state. We are committed to meeting individuals where they are, where it is convenient, familiar, and safe. The department is making also a renewed push to ensure residents get their second dose of Moderna or Pfizer vaccine. Our call center has begun calling and texting individuals who may have missed their appointments for their second dose. We are seeing high rates of those returning for their second shot. Overall, approximately 92% of individuals have returned for their second shot in the state. By getting fully vaccinated, residents can help protect themselves and others, enjoy more activities with families and friends, and help us control this deadly virus. You must receive 2 doses of the Pfizer or Moderna vaccine to get the best protection against COVID-19. We are pleased to report that over 4 million New Jerseyans are fully vaccinated and almost 5 million have received at least 1 dose. More importantly, 88% of our highest risk individuals, those 65 years of age and older, have received at least 1 dose, and 80% of the individuals in our state, 65 and older, are fully vaccinated. Residents can get their second dose anywhere in the state. They don't have to return to the site where they received their first dose. So if you missed your appointment or you're a little late, it's still not too late to get that second dose. Vaccination percentages are rising among all age groups in our state. 88% of those, as I said, 65 and older, have received at least 1 dose, and 80% are fully vaccinated. 74% of those 50 to 64 have received at least 1 dose. 61% of those 30 to 49 have received at least 1 dose, 49% 18 to 29, and 39% 16 to 17. And the percentage for those ages 12 to 15 who have received at least 1 dose of vaccine is rising rapidly in the state and is now up to 21%. I want to thank the parents of those individuals, of the younger individuals who understand the value of this vaccine and are consenting for their children to get vaccinated. The best thing parents can do is to protect the health of their children, and that's to vaccinate them against this virus. So visit covid19.nj.gov/finder or call 855-568-0545 to schedule an appointment. Moving on to my daily report, as the governor shared, our hospitals are seeing decreasing trends in their census of individuals with COVID-19 and report 518 hospitalizations of COVID positive patients and PUIs. Fortunately, there are no new reports of multi-system inflammatory syndrome in children. There are cumulatively 126 cases in our state, and none of the children are currently hospitalized. There are no new cases among the residents at our vet homes and no new cases among our patients in our psychiatric facilities. As of May 29th, the daily percent positivity in New Jersey is 2.12%. The northern part of the state reports 1.77%, the central part of the state 2.48%, and the southern part of the state 2.39%. So that concludes my daily report. Please continue to stay safe and let's get vaccinated. We're seeing the benefits of vaccination with more activities opening up in our state and less virus circulating in our communities. Now is the time. If you haven't done so, Let's get vaccinated. Thank you.
Judy, thank you. The Grateful for the Shot program is a really successful and cool one. I believe you were in Lakewood. Tammy was in Newark, and even in bad weather, which held numbers down, it continues to be a very successful program. And I would just say this, to the 235 people who went to the beach in Monmouth County Saturday and Sunday, they have redefined hearty and strong of body and mind and soul because the weather was absolutely miserable. So I frankly think that's a success given the awful weather. And I should say this is a general matter, not specific to vaccines, but I don't know about you all, but we were out and about. We went to a soccer game. We went out to dinner a couple of nights. It just felt, first of all, places were packed, and it felt like a burden, like a house had been taken off of people's shoulders. The spirit, we were on the shore for most of our time, was just really, really, really strong, even in the face of, on Saturday and Sunday, biblically bad, miserable weather. So, Judy, thank you for everything. Pat, I know this is the beginning of the hurricane season. And, at one level, we talked about this earlier, we'll probably be hearing a lot less of executive order compliance violations because we're going to have a lot less restrictions. But folks have to remember still, if you're on a train, a plane, a bus, in a state office building, at least for the time being, a healthcare setting, a prison, there are a number of vulnerable community settings. Folks still are required to wear a mask, and they will likely be required to wear one, at least for the foreseeable future. And folks have to abide by that. So with that, great to see you, Pat. Thanks for everything. Over to you.
Thank you, Governor. Yes, and we will continue to monitor those settings where masks are still required, whether that's Port Authority, NJ Transit, state office buildings. So we're going to continue to monitor that from the Rock. And to your point, yesterday did mark the official kickoff to hurricane season. That is a year-long process for us, Governor, as you long know, with our federal, state, county partners, going through plans and procedures, and that decision support tool have all been updated. Our task force is certainly ready to deploy in-state or around the nation if need be. I did see that the National Oceanic and Atmospheric Administration, or otherwise known as the NOAA, their climate prediction folks are predicting an above normal season. And that kicked off last week with the first named tropical storm, Anna. So we obviously in New Jersey as a coastal state don't take hurricane predictions lightly. And I would just remind everybody of our website, ready.nj.gov is certainly the place, that one-stop shopping with regards to survival kits, to go bags, which have a few nuances now with due to COVID, whether that's hand sanitizers, soap, cloth, face coverings. Having that communication plan with your family is critical. And I also remind people, if you or a family member or neighbor has special needs, to visit Register Ready and that registry for disaster planning. That's registerready.nj.gov. It's important, whether that's for our electric power service providers to make sure that we focus and prioritize where power goes back on. But again, that's registerready.nj.gov. And as a dog lover and dog owner, I also remind people to include your pets in the plans. We saw it after Sandy. A lot of people did not evacuate because they didn't have a plan for their pets, and you put your life in danger, you put first responders' life in danger, and that's animalemergency.nj.gov, which is we have animal response teams, believe it or not, ready to shelter people's pets in the counties throughout New Jersey, because it's sometimes an overlooked point of disaster planning and preparedness, but it's one that I just remind everybody about. So, and I will take you up on July 4th, Gov, for that Anheuser-Busch deal that was announced today. Thank you.
This bud's for you. As a fellow dog lover, I echo your admonition. Thank you, Pat, for everything. So we will, I think Michelle will coordinate. We'll take a few questions. We will be virtually, we'll go back to the rhythm that we've been on. We missed Monday because of the holiday, but we'll be back virtually Thursday, Friday over the weekend, and we'll be back in person at the War Memorial in Trenton, unless you hear otherwise, next Monday at 1 o'clock. And we'll communicate our numbers either at other events if we're on the road, or alternatively electronically over the next couple of days. So with that, Michelle, let's tee up a few questions and go from there.
Great. We will start with Matt Arco.
Hello, Matt.
Good afternoon, Governor. Real quick, how many breakthrough COVID cases do we have in the state from people who have been vaccinated? And are there any plans from your administration to extend the utility moratorium that's set to end at the end of this month?
Matt, I'll defer to Judy and Tina on the breakthrough cases. I think we can safely say, by the way, this is not your question, pretty definitively that folks who are getting hospital or sadly passing will increasingly be among the unvaccinated population. We don't have a number to hang our hat on yet, but that is at least the overall sense based on national research. Nothing new to report on the utility moratorium, but we'll likely have news on that one way or the other in the next week or two would be my guess. Judy or Tina, any reaction on the breakthrough cases?
Yeah, I think Dr. Tan has some info on that.
Yeah, we're still actually in the process of finalizing our reports on our vaccine breakthrough cases at this time. But what we can say is that right now, what we're seeing in New Jersey, and then what's being seen nationwide as far as vaccine breakthrough cases, and we define that as any sort of COVID case that's detected 2 weeks after you get fully vaccinated, is that it's very rare. We anticipate that they're probably associated with individuals who might have been had underlying issues. We also know that vaccine breakthrough cases probably are less likely to be more serious, less likely to cause more severe consequences. We know that also that CDC right now is currently following vaccine breakthrough cases that are primarily among hospitalized individuals or individuals who had died because of the need to look at the more serious public health issues associated with that. And just to remind everybody that, when you talk about vaccine effectiveness, we'd like to look at the studies, the ongoing analyses of vaccine effectiveness overall as a better indicator of how well the vaccines are working. We know that CDC has many of these vaccine effectiveness analyses that are going on at this time, because this kind of is a more robust way of capturing a comparison between unvaccinated and vaccinated individuals. And based on the vaccine effectiveness data to date, we know that our current vaccines that are available here in the United States are effective in preventing our COVID-19 cases in general, both asymptomatic, milder illnesses, as well as more serious hospitalizations and deaths.
Tina, thank you for that. Matt, thank you. I should have said that we've got Paramel Garg on as well, our Chief Counsel, to answer any questions. Michelle, back over to you.
Great. Next, we'll go to David Wildstein.
Hello, David.
Hey, Governor, how are you?
I'm well. How are you?
Well, thank you. I have two questions. One is for Superintendent Callahan. A 5-year-old child named Dulce Alvarez went missing in September 2019. Some members of the Bridgeton community have said there's concerns by potential witnesses that their legal immigration status might hamper their willingness to come forward. So my question is, will law enforcement ask about legal status if someone comes forward as part of that investigation? And secondly, are there any developments in finding Dulce Alvarez? And Governor, one question: the Attorney General is opposing a lawsuit to eliminate organization lines. Does the state's position on that lawsuit necessarily reflect your position?
David, good to hear from you. I'll answer the second first, and I'll give one thought on the first one, or two thoughts. I was asked this, I can't recall if it was at a COVID briefing or in some other format. The organizational lines are based on statute, and the Attorney General and his team have an obligation to defend the law. And that's the position that they're taking, unless Paramount Guard disagrees with me. They're doing what they're required to do. And again, I've said this, I was asked about this yesterday in Camden. I'm very much open to a discussion about ballot design without question, but I do think it's a false premise. And David, in fairness, you're not making this, so this is not directed at your question, to sort of have this notion that, you know, there's a bunch of machine politicians on one side in one line and a bunch of enlightened candidates independently, of independent mind in other parts of the ballot. There are good people all over these ballots, and that's always the case, regardless of where they may fall. On the first one, first of all, it is a tragedy. Bless this little girl who continues to be missing. And secondly, Pat, unless you or Paramount disagree, the Immigrant Trust Directive that the Attorney General promulgated early on in our time in office, it speaks explicitly to the fact that immigration status is of no interest as it relates to an investigation like this. Is that a fair assessment?
That's correct, Governor. I was going to point right to the AG's Immigrant Trust Directive for that reason, to not want to quell or prevent witnesses, especially in a tragic case like this, from coming forward. And our missing persons unit, it is still an ongoing investigation. A lot of time's gone by, but it's not a day goes by that our missing persons unit detectives are not focused in on this investigation.
Amen. And bless that girl and keep her in your prayers, everybody in her family. Paramount, anything good out? Are you good?
I'm good, Governor.
All right, thank you for that. Michelle.
All right, we'll go to Alex Zidane.
Alex, did I hear?
Good afternoon, Governor.
Hey, Alex.
I wanted to ask you about the new version of the public emergency bill that was posted today. Do you support the provision of that bill that includes extending immunity, legal immunity, for healthcare workers and facilities until September 1st of this year? Would that potentially immunize nursing homes against any sort of bad actors that you've mentioned that you believe did occur during the pandemic? And it still contains 14 executive orders, which would extend through January 1st of 2022. Why do you need all this power when you could simply declare an extension of the public health emergency, and your governorship is already, your office is the most powerful in the nation?
And Paramount may want to weigh in, Alex. Thank you for those questions, all good ones. Don't be disappointed. I will not comment on the specifics of the bill, but I will say this, that between our office, the Assembly speakers and his office, the Senate President and his team, we've had a very good level of cooperation on bringing this to a good, rightful resolution. You know, we have said for some time, we don't want to extend these health emergencies any more than anyone else does. And both the legislators on their side and we on our side committed to working together to put into statute our ability to on the one hand, bring the health emergency reality, which we have to re-up every month, to a close. And on the other hand, to make sure that we have the abilities still, particularly if this thing takes a U-turn and comes back on us, that Judy has the ability to deal with at a level of information that we need with our hospitals, that we've got the ability to do the testing or the vaccinations that we need to do. And again, I want to give a shout out to the legislative leadership. I haven't said this in a while. This may be a little bit dated, but notwithstanding the legislation, Alex, that you referred to, it's not as though the Department of Health has been sitting on their hands as it relates to long-term care providers and operators who, didn't do the right thing. At one point, Judy, this is stale. We should update this. But about a month or so ago, I know you had crossed 1,000 infection control inspections, more than 500 regular surveys. You had dealt with 750 something complaints, 600 and something deficiencies have been cited, $2.2 million. Again, this is dated at the time of penalties had been imposed against 79 providers. We should update those numbers. So notwithstanding the good questions, Alex, that you've asked, it's not as though we've been sitting still and calling out operators who did not do the right thing. Again, like everything else in life, most of the operators did the right thing, but not all of them did. Thank you for that. Michelle.
Okay, we're going to go to Charlie Cradaville.
Hello, Charlie.
Hey, Governor, how you doing?
I'm well. How are you doing?
I'm good, thanks. My questions are for Commissioner Perzakilli. You finally backed off of the suppression of case and death data for populations less than 20,000. When was this change made, and who made it and why? For the record, I think it's a good change. And then also, I've been trying to get some information about the contract for the vaccine call center on February 3rd. I asked for the basics and was told by Department of Health to file an OPRA request. I filed that OPRA request on February 24th, got radio silence. April 5th, I was told that the DOH estimates it will be able to respond to my request on April 23rd. And here we are nearly 6 weeks later and no response. So can you give me some basics on the contract, like the value of the contract? And will your administration ever release the contract with Extend? And why do officials at Department of Health direct reporters to file OPRA requests when they're not prepared to respond to those OPRA requests in a timely fashion? Thank you.
Thank you, Charlie. I'll start and then hand things over to Judy if that's okay. I'm told that was our last question. Not because of the nature of the question, Charlie, but I was told that even before you asked it. I would just dispute the word suppression with all due respect here. We're not in Belarus. This is the United States of America. It's New Jersey. We believe in transparency. Judy expressed rightful concerns, I think, about, and listen, there's a healthy debate on what number, what population size can you go down to that you feel like you're not compromising individuals' privacy and health data. And that was the reason. It wasn't for any reason to suppress. And I think separately, Judy, we should follow up with Charlie on the vaccine call center. We have no problem sharing that information. Mahan is running the show today. Mahan, make sure we follow up with Charlie. But Judy, anything you want to add to either of those? And I think especially the first one, was there anything in particular that prompted you to lower the threshold? I assume the number of cases at a certain point when you combine PCR and presumed positive antigen, we're over 1 million cases. I assume the law of large numbers must have been a factor there. You're on mute.
You're absolutely right. I don't remember the exact time frame, but we had a lot of discussion at the department pertaining to privacy issues and making sure that we release data in such a way that people get the information that they need and to be as transparent as we can be without compromising anyone's individual privacy concerns. There was nothing more or less than that. On the other hand, as far as the contract for the call center, that was fully bid according to all of our procurement policies. And I don't see any reason why it cannot be released. So I'll have to get back to Charlie.
We'll do that, Charlie. We'll get back. Mahan will be, we'll put that in his broad shoulders.
Thank you.
My pleasure. Thank you, everybody. I want to thank clearly Judy, Pat, Tina, Paramount, and the team on the screen. I want to thank Jeff Zients in absentia, who's been a great partner and has just been a transformative figure in the Biden-Harris administration. So I thank him and his team. And I thank each and every one of you who are watching. I mean, we continue to move the needle dramatically in the right direction. It's allowed us to open the state up wide. We're taking some more big steps on Friday. There's not much left other than those in those particular settings I referred to earlier when I was introducing Pat, where we do need you to wear a mask inside. By the way, I'm walking across, I'm in Newark, into my offices. I've got this, I'll be putting it on as I traverse back in. State offices are on that list for places where you need to wear a mask. And again, to each and every one of you, huge thanks for everything you do. We will be again together. We'll be on the road in one form or another the next couple of days. Some amount of politicking for me over the weekend as the primary is next Tuesday. And then we'll be back in person with you next Monday at 1 o'clock. And again, to each and every one of you, thank you. Stay safe, everybody. Thanks for everything you're doing, and God bless.
Bye-bye.